Good evening, everyone. Thanks for taking the time to join us for this launch for this exciting new campaign we have to fight back against Bill 195. I'm Fred Hahn, President of CUPE Ontario. We're just waiting as people join the webinar and are ready for our launch. While people are joining, I just want to remind folks that during this event tonight, we're going to be unveiling our new joint campaign that we are doing with the Ontario Council of Hospital Unions called Restore Our Rights. Abuse of power betrays heroes. The agenda tonight is going to be as follows. I am going to be joined by Candice Reddick, who is the Secretary Treasurer of CUPE Ontario, who's going to provide you with an overview of the campaign, including what Bill 195 is, how it impacts workers, and why we need to challenge it. Michael Hurley, who is the president of the Ontario Council of Hospital Unions, OCHU, will be providing us with an update about how emergency orders are impacting hospital and healthcare workers and what OCHU's response to Bill 195 has been to date. Carrie Lynn Poulcottom is CUPE Ontario's Social Services Chair. She's going to tell us about how the bill is impacting social services workers. Ann Jenkins is the CUPE Ontario Municipal Workers Chair, and she's going to talk about the impacts to our municipal members. I'm going to provide a bit of an overview of the campaign materials, the actions we need you and your members to take to help fight back. We're going to review materials like posters and fact sheets and social media shareables, all on a website available for folks tonight. And then we are going to open it up to you and take questions. I just want to remind folks that there are folks joining from across the province tonight on this webinar. And so we're going to try to make sure that people have all had a chance to sign in and be with us before we get started. I'll remind you that you might want to have a pen and paper or some way to take notes and write down the information you hear tonight. But much of this information will be available, all of it actually, available on our website. If you get disconnected or somehow bumped from the call, just click right back on the link you got to join the webinar. And you can also go to cupe.on.ca/restore our rights webinar. I just want to let folks know that at any point during the presentation, if you have a question and you want to ask it, tonight what we're going to ask you to do is use the Q&A function that Zoom has. We won't be bringing people on live to speak because we're going to have a bunch of people on online tonight. But instead, Candice is going to be watching the questions that you ask that are coming in from members, helping to group them so that we can have as many questions answered during the Q&A portion as we possibly can. The Q&A function button will become visible if you move your mouse near the bottom of the screen. A dialog box will open up when you click on the Q&A button, and that's where you can add your question. Please put in your name and local number as well. So I'm just checking to see how we're doing with numbers, and I think that we should be ready to get going. So I am going to turn things over. Yes, I think we are ready to get going. It is my pleasure to introduce my co-officer at CUPE Ontario, Sister Candice Reddick. Candice.
Thanks so much, Fred, and so great to see so many folks on with us tonight. Thank you very much for joining. So as many of you know, when COVID-19 first hit, Ontario declared a state of emergency. This allowed for a range of emergency orders that really shuttered non-essential workplaces, bars, restaurants, outdoor spaces. It restricted social gatherings, and it unshred a range of other measures that impacted all of us. But less known to most Ontarians is that there was also an emergency order, or several orders, which impacted freely negotiated agreements between frontline public sector workers and employers, permitting employers to ignore sections of our collective agreement. These orders, meant to be temporary measures, and that's an important point, temporary, to handle a fast-changing crisis, have now been extended indefinitely through Bill 195. So although Bill 195 ends the state of the emergency, meaning others will see an easing of restrictions, The government is now extending its extraordinary, undemocratic, and unprecedented powers over the working conditions of frontline heroes, the working conditions of our members. With these orders, employees can have their shifts changed from days to nights. They can be reassigned to other jobs. They can be relocated to another community, laid off without notice, and even have their parental leaves canceled. All of this can happen at the discretion of the employer, who is under no obligation to consult with workers, and without even having a single confirmed case of COVID-19 in the workplace. And it can ignore hard-earned and necessary provisions of our collective agreements. I'm going to turn things back over to Fred for a minute. Fred, go ahead.
Thanks, Candace. Frontline workers, including close to 130,000 CUPE members, are impacted here. And they have been working hard, protecting and serving us all to keep our society going during this pandemic. We all of us deserve respect. We deserve to have our basic rights upheld. Our members working frontline through the pandemic have sacrificed so much. We've seen our members having to be quarantined from their loved ones, forced to interact with their children through plexiglass barriers. We've seen workers with lesions across their face after hours and hours of having to wear layers of PPE. We've seen our members working completely different jobs in completely different locations on different shifts and very long hours, all to pitch in to ensure that their communities got through this very scary and challenging pandemic, especially in the early days. But we've also seen our healthcare system fail frontline workers in that system, particularly those in long-term care facilities. Who have been disproportionately and tragically impacted, and many have died from COVID-19. Similar failures have happened in social services and in municipalities, and we've seen how government's failures to adequately fund urgent needs have had impacts on our ability to provide high quality public services. To have the very same frontline heroes who have endured so much also have their legal rights withheld from them is untenable. And it's why we must oppose this. It's why CUPE Ontario and OCHU, the Ontario Council of Hospital Unions, are launching this important campaign. Restore Our Rights. Abuse of power betrays heroes. Emergency orders can be revoked at any time. And that's the goal of this campaign. But it's going to take momentum and political pressure to make that happen. We need to make sure that to show the decision makers that frontline workers matter, that our legal rights matter, which is why it's going to be so important to come together and to stand together to restore our rights. Some of the components of the campaign include a call to action for members to take action at work every Thursday, where members are going to be encouraged to print off campaign posters, to take selfies and group photos with their colleagues at a break or at lunch with the campaign to help spread the word and to share those photos with us. There's a comprehensive website hub that features an online e-action directed at the Premier and MPPs, downloadable fact sheets, posters, social media shareables, and more. There will be a wall-to-wall social media series as well to help to share this information on the bill and to help to generate people to take action to help defend our members' rights. And there are 22 regional rallies at PC MPP offices across Ontario. We are going to go through the full list of rallies and talk about that later in the discussion. But as I mentioned, it's important for us all to hear from other leaders in our union across CUPE and the unique impacts that this bill is having on workers in healthcare, in social services, and in municipalities. So it's now my pleasure to hand things off to Michael Hurley, who is the president of the Ontario Council of Hospital Unions. Michael.
Thank you very much, Fred, and thank you very much, all of you, for joining us this evening. I wish we were meeting in different circumstances. In March, when the Ontario government introduced an emergency order that overrode the collective agreements for long-term care workers, people in some social services and municipal services like wastewater and the hospital sector. At that time, there were like 1,100 new COVID cases a day. There was concern that the healthcare system was going to be swamped. And as we move deeper into the crisis, particularly areas like long-term care, were battered by the onslaught from COVID. But that's not the reality in July and August in Ontario. Today, there are 76 new COVID cases, which when you measure that against what's going on in the United States, is actually a very modest increase in the number. And yet the Ontario government in July, with only a handful of days of debate and with no committee hearings and accepting no opposition amendments, extended all the emergency orders, including the ones that overrode our collective agreements. And the override on our collective agreements is an indefinite one. It's going to last at least a year, but it could, with a simple report to Parliament, be extended by another year and then by another year after that. And those orders allow the employers to do a number of things, like, for example, bring in people to do our work. They can bring in contractors if there's not a layoff. They can change our shifts. They can move us to another site. They can change our jobs. They can effectively eliminate our jobs or lay us off without notice. They can end parental leaves or vacations. So these are hugely serious powers. And I have to say, I have never seen an intrusion into free collective bargaining like this, overriding collective agreements for basically a semi-permanent period by any government in Canada. So the question really becomes, what are we going to do about it? And I know for those of us in healthcare, many of us in social services, like people working in developmental disabilities, there's been a tremendous sacrifice in meeting this onslaught of COVID. We were not prepared. We were not equipped. We were not provided with the kind of equipment that would keep us safe. The Ontario government's view of how this virus is transmitted was antiquated and way behind many Asian countries like China and Vietnam and Taiwan and Singapore. And as a result, we have in the healthcare sector, by official numbers, 6,575 healthcare workers have contracted COVID and 14 have died. I give you that as an example and put that into context. Almost 18% of all Ontario's cases at one point were healthcare workers. And to put that in context, the average worldwide is 6% healthcare workers against total cases. In China, it's 3.8%. Ontario lost 14 healthcare workers so far. China lost 27 and has 100 times the population. But in addition, there's other sacrifices people have made. Half the frontline workers have isolated and sheltered themselves from their loved ones. They've lived in their basements and trailers and sheds so they don't bring the virus home to them or from them to the people that they care for. Many people have taken a financial hit. I know many of our members are in layoff across sectors, but in long-term care and in healthcare in particular, there's been a financial hit of a relatively enormous type to part-time in particular, with a one-site rule that limited their ability to work. I just say all of that because I think we all deserve better from the Ontario government, and we cannot accept these overrides. We have to fight them, and we have to crank our members up. And all of us acknowledge that our members are in a period where it's a challenge to mobilize. But that's going to be what we have to do. Hospital locals and the affiliated long-term care members in Ochu did a 5-minute work interruption, and we also did workplace rallies a couple of weeks ago. And now we're focused on focused on trying to make these regional rallies, which are being held in conjunction with CUPE Ontario and possibly with other unions, certainly the ones in Thunder Bay and will be with Unifor, and the Sault Ste. Marie one, and the OFL is also interested. Labor councils are joining in now, other unions are interested. But they won't, while the hospital and our long-term care locals can provide a respectable turnout, what we really need is to shock the PCMPPs. We need turnouts which are eye-opening for them. We need this to be the beginning of a mobilization which really deeply starts to concern them. We're in the lead up to the provincial election, and we need to do everything that we can to make this happen. There will be a legal challenge to this bill, of course, and many of us have already served our employers with notice that no power should be exercised under this legislation in a workplace that has no COVID cases. That's a whole other discussion, but the immediate challenge is to mobilize people to these rallies and into workplace demonstrations. So we're asking you, please, to make this a priority. The union hasn't asked for a lot in terms of booking people off to attend things. These rallies are 11 in the morning. We need people to be booked off. We need locals to be releasing their executives to come, because we need to make this a priority. The rallies will be about an hour long, and we need to make them as successful as we can. We'll try to answer any questions that we can. I would just say in conclusion, one important thing about this bill is that it doesn't have to be repealed. This bill can be amended at any time. And so our campaign demand to restore our rights simply requires the Ontario government to pass a regulation to amend an order or delete an order that overrides our collective agreements. This they can do at any time. These rallies go to October 28th. It's important that we commit. After October 28th, there's going to be phase 2, and we're going to carry this on until we're liberated from these constraints on our collective agreements. If there's ever been one union in Ontario which has been able to provide leadership to the rest of the labor movement, it's CUPE, and it's time for us all to step up now. Thank you so much, sisters and brothers.
Well, thanks everyone for putting me on the list right after Michael and that amazing wind up at the tail end. I'm Carrie Lynn. I'm the chair of the social services sector, and I wanted to talk a little bit about the impact that Bill 195 and these orders have had on the members in social services. Frontline workers in these sectors, including those in developmental services, childcare, community agencies, municipal social services, have been forgotten by Ford's COVID-19 response and recovery plan, and they feel betrayed by the bill's overreaching scope and removal of intrinsic and hard-earned workplace rights. Workers in social services are experiencing elevated rates of fatigue and burnout as a result of these emergency orders. Many are working longer hours for days on end and fear risk of exposure to COVID every day. I spoke with one worker in community agencies who told me that they were afraid to hug their child because they worried that they may have contracted COVID-19 while on the job. This is one of countless stories of the sacrifice of frontline workers that they make in order to help us through the pandemic. Many social services employers, including those workplaces without confirmed cases of COVID-19, have moved to 12-hour shifts, have been changing shifts whenever they desire, and without consultation, and have even implemented travel restrictions on workers and even haircuts. Many workers across the board have experienced significant hour reductions and pay loss as a result of the employers moving to alternate shift durations and forcing workers to choose a sole employer, agency, care setting, or even residential home. For instance, in developmental services, many workers rely on taking shifts from multiple agencies in order to get something close to full-time hours. Since full-time positions in this sector are so hard to come by, that coupled with the low pay and precarity of this work has resulted in the loss of hours and in turn, the loss of pay, because the emergency order limits the number of employers or even group homes a frontline worker can have at any given time. We spoke with one developmental service worker who told us about how challenging the isolation and quarantine has been on the people that they support. People with developmental disabilities are forced to stay homebound since the onset of this pandemic. And even still to this day, it's very challenging for them to leave their residence. The very nature of their day-to-day work has fundamentally changed, presenting new challenges that fail to be addressed by employers and our government. Some employers are erroneously applying drastic limitations on workers outside of the parameters of the emergency orders by limiting them to work in the one group home care setting, despite these settings being operated by a sole employer. Workers in childcare rose to action to provide care to fellow frontline workers at the peak of the pandemic. And in return, our government blindsided the sector with no new funding or support to ensure centers could safely reopen. While Ford was busy signing off on emergency orders to force childcare centers to halt fee collection, we were calling for a system of high quality, safe, universally accessible childcare. Clearly, the government is dangerously disconnected from frontline workers. The bill is broad, leaving room for precarious and long-term implications extending far beyond the current pandemic. Workers in social services are concerned by the government's power grab, especially in consideration of its history of notorious cuts to vital social services. We keep hearing all of these stories about what's happening on the front line, yet our government refuses to address those who have fallen through the cracks. Frontline workers are in the best position to tell decision makers what's needed on the front line and in response to COVID-19. It's high time that our government actually listens to them. Workers in social services are burned out, exhausted, and many are still struggling to survive. And the elimination of emergency orders that override collective agreements is our first step to addressing the systemic issues facing workers in social services. I know that workers in social services will support this campaign in whatever way that they can. It's time for action. I'm now going to hand things off to Ann Jenkins, Chair of the Municipal Sector.
Thanks, Carrie Lynn. Hi, everyone. My name is Ann Jenkins, and I'm the chair of the CUPE Municipal Sector. Our sector has 80,000 CUPE municipal workers across Ontario in 195 municipalities. I would like to speak a bit about the implications of Bill 195 for municipal workers and why it's so important that we stand together and fight it. The municipal emergency order issued in April made it possible for municipalities who have declared local emergencies to override collective agreements, as long as they linked the decisions to the prevention, mitigation, or reduction of the effects of COVID-19 on critical municipal services. As with other orders, the municipal order has been extended under Bill 195. Throughout this crisis, CUPE members worked and have been very flexible. We've worked with our employers to come up with creative solutions to keep people on the job and delivering the crucial services during the pandemic. In fact, many of our municipal locals worked with the employer to come up with agreements to fight this pandemic together outside of the emergency order. We are proud of the work of the many sacrifices our members have made to ensure that our communities kept running. However, the provincial government is rewarding these sacrifices by extending our employers' powers to take away our legal rights that we fought through collective bargaining. We know that a vast majority of municipal workers in the province have the potential to be impacted by this bill. Whether they are affected by Bill 195's extension of the municipal order or by its extension of separate sub-orders, which likewise will take away from fundamental workers' rights. We face a very real possibility that our employers could take away our hard-won rights at any time. As you have heard, many CUPE members are already being directly impacted by our government's abuse of the power. The municipal sector needs to stand up for our members who are currently affected and demand better from our province. We need to fight harder to prevent this from happening to anyone else. An attack on one worker is an attack on all. As municipal workers, we need to stand together against this government's abuse of the power and demand an immediate revocation of this emergency order that removes our legal rights. Off to you, Fred.
Thank you, Anne, and thank you, Michael and Carrie Lynn. It's so important that we hear about how this bill is impacting our members who work in different sectors. We need all of you to take part in this campaign to restore our rights. And there are a number of ways that you can do that. So I want to show you through the campaign materials and show you what I mean. So first, this is our website hub that's on our website at cup.on.ca. But I want to note all the campaign materials, including the website, the graphics, all of it is available in both English and French. For those who use our French website, you would just toggle to the French website in order to do that. So again, this is the main homepage that you're seeing. It includes printable posters, social media graphics for all the major platforms, an RSVP form for the political protest rallies to show us that you're coming to that rally, an e-action to tell the Premier to restore our rights, and a fact sheet containing all the information on the bill and the ways that it impacts us. So as you'll see, we wanted to focus the campaign art around highly emotive, COVID-19 relevant, eye-catching images. Included in that are images that impact some of our members and try to show some of the work of our members. But it's one of the reasons why we want you to take pictures of members at workplaces, in front of workplaces at a break, or at a shift change, so that we can get more and more pictures of our members from different sectors to be able to continue to reflect our members in this campaign. The arrow in this graphic represents the restoration of our rights. And since emergency orders can be revoked at any time, that's our goal, to restore our rights. Each graphic will be centered on taking action. So it's important for us to ensure that we have multiple entry points for people in the campaign, from simply sharing this kind of image on social media, to signing an e-action, to actually organizing in your workplace to take a photo with others in your workplace and send it back to us, and to attend the rallies near you, and to book people off to actually get numbers at these rallies that happen in your community. These are all actions that we need people to be a part of, and that we need you to personally commit to helping us to organize in your communities. If we're going to go to the Take Action section, we're going to encourage everyone there to take action on Thursdays. We're going to ask people to do this every Thursday, starting next Thursday, by printing off posters. You can see those posters now. They come in black and white and in color. And there are a range of posters. When you click on them, there are a few different slogans, you know, that you'll see: restore our rights and heroes deserve better. There's a range of them. You'll be able to print off all of those posters, or the ones that are that you find most relevant. We want you to be able to print them off and to be able to then pose and take pictures with them. And there are instructions on the website about how to do that. If we go back to the Send a Message to Doug Ford, you'll be able to see in that tab that there is an e-action here. It goes directly to the Premier, but it is also sent to your local MPP. It talks about restoring our rights. And so we're going to want all of you to not only sign this e-action, but to send it through your membership, to make sure that your members get it in their email boxes, that they understand how it's important for them to actually fill it out, that they share it with their family, with their friends, that they get as many people as possible to participate in this e-action. Then there is a tab that talks about regional rallies, and these, as you heard, are very important. There is an RSVP form for each of the 22 rallies. They are listed here on the website by their date that they are happening. And we're going to ask people to go here to get these details and to actually send an RSVP and tell us that you are coming to one of the rallies in your community. It's very much based on folks in your community. This is not about people being bussed around the province. This is about all of us showing up in Pembroke for the people who work in Pembroke and surrounding area, in Cornwall for the people who work in Cornwall and surrounding area. And we're going to be at the Tory MPP offices because it was the Conservatives who passed this legislation. We're going to encourage you to find the local rally near you and to come and show your support. But I want you to know that we're also going to try to add a function here. We've already had some folks asking us, hey, is there going to be a rally in my area? And if you don't see your community here, there might be a way that we can help you to organize an event in your community with your members and others in your area at a Tory MPP's office near you. If you go to the social media tab, the shareables, you'll see that we have a social media toolkit that includes graphics for Twitter and for Facebook and for Instagram. So all of those things are there and available as well. And then there is a fact sheet that is on the website as well. And so we're gonna, if you go to that section of the website, this fact sheet, we're gonna encourage you to, where you can, print this out and actually put it on your union boards in your workplaces. Take this fact sheet and send it electronically, email it to every member of your local. Make sure that people have this information in their hands, and it will help us to make sure that we can help to mobilize our members. I'm going to pass things now back to Candace Rennick, our Secretary Treasurer. Candace.
Okay, thanks very much, Fred, and for all of the speakers, and most importantly, for all of the members who are sticking around on the call. Thank you so much. We really want to hear from you, and we've had several questions coming in. But before we go to some of those questions, we want to ask you folks a couple of questions. You're going to see a poll on the screen in front of you, and we have 2 questions for you to respond to. So the first question is, will you commit to organizing an event on a Thursday in your workplace and share photos with us for promotion? So Fred just went through a whole range of things. Will you commit to organizing a Thursday event in your workplace? We want you to share the pictures. People are voting. The results are pouring in front of us. I want to give people just a few more seconds to cast a vote. So again, will you organize an event based on the items that Fred just articulated on Thursdays in your workplace? And I think we will call it now. That's great. So 75% of you have said that yes, you will organize an event in your workplace on Thursday. If you're one of the 25% of people who have indicated no to this and you want to have further conversations with us, please reach out to CUPE Ontario, Fred, myself, our campaigns department, to see if there's any kind of additional support that we can provide to help you get to that place. So thank you very much for that support. The second question is, will you mobilize your members to attend the rallies scheduled for your areas? So again, will you mobilize members to participate in and attend the rallies that we're planning across the province? Again, the poll is before you. Please feel free to cast your vote. Like the previous poll, the results are coming in. I'm going to give people just a few more seconds. Will you participate in the rallies being organized in your area? And super glad to report that 95% of you have said, yes, you will participate. So that's great. We really look forward to your participation and most importantly, to mobilizing your members. So as Michael and Fred and others have said, we can have a real impact on the doorsteps of these Conservative MPPs who are, violating our rights. So those were the 2 polling questions that we had for you folks. Now, many of you have been asking questions as this webinar has been going on. So I want to address just a couple of those things right now before I turn it over to others. One, for those of you who are asked if you're muted, yes, you're muted automatically. We cannot hear you. 2, people have been asking, can we see others? We want to know who else is on the line. We don't just want to see the panelists. Can we see others? This particular webinar isn't being set up that way, but point taken, we'll look at that for the future. And if we can open it up so that you can see who else is on the line, we can look at that for the future. For those of you who have raised your hands and want to be acknowledged through the raise your hand function, we're not actually acknowledging the raise your hand function. You have to type your question into the Q&A. So please do that. There's a question, because this is being recorded, can it be posted online and shared so that we can share it with our members? I'm just gonna go out on a limb and say, yes, we can do that. We will post this recording on the Bill 195 section of the CUPE Ontario website, so you can find it there and share it for future information with your members. So now getting to some of the questions. Michael, I'm going to go to you for the first question. Someone has specifically asked, when should locals serve legal notice to our employers regarding Michael Hurley's comments? So Michael, do you want to take that and provide clarification on that question, please?
Yeah, of course, Candace. It's an interesting legal question about whether emergency powers can be exercised in an environment where there's no emergency. And the legal advice that we've received is that if you take, for example, a long-term care facility with no COVID cases, it wouldn't be legal to use these powers to reassign people, for example, in that environment. It may be more complex in a municipality which has COVID cases. Each of these things needs to be looked at separately. But you know, hospital locals have served their employers with a notice to this effect, because many hospitals actually have no COVID cases. We did have a discussion, Fred, with the senior staff about this, and we're going to get communication out to the locals about this shortly. So there will be an official communication from CUPE about our position on this issue, and I hope that will be clear for you. But it's a pretty simple notion, really. If there's no emergency in your workplace, there's no justification for the employer to use emergency powers, and we need to grieve or take other legal judicial action to prevent that from happening.
Okay, thank you very much, Michael. We have just a couple of other small questions. People want to know how many people are on the call. We have over 220 members on the call, so thank you very much for people joining us. The next question is, for those of us who are on emergency leave, when can we anticipate a return to work call, and should we be concerned about permanent layoffs? Does anyone want to take that? Fred?
Try a little, and Anne might want to talk a little bit about this too. I'm sure this is a municipal member. We've been advocating, and I want to thank Anne and OMEC, the Municipal Employees Coordinating Committee, who worked with us to get to do joint work with AMO, the Association of Municipalities of Ontario, the employer group, to push the provincial government to actually give additional funding to municipalities to fill the hole that was created, and to ensure that we can try to bring back as many jobs as possible. That money was announced both by the federal government and the provincial government. They have matched it, and just 2 days ago, the provincial government actually put out a bit more detail about how they're going to be distributing that money to municipalities. Just earlier today, I haven't even had a chance to tell Anne this yet, but I spoke with Brian Roxborough, who is the executive director at AMO, we are clearly of the opinion that municipalities were waiting to call, in part, they were waiting to call back workers who were on emergency leave or layoff because they were uncertain about their finances. There should be sufficient resources here once this kind of stuff unfolds, that municipalities are going to be able to call back people. So we hope that those callbacks are going to start to happen very soon. There are municipal locals, Anne can talk more about this, where this has happened. Different cities and towns are doing different things. But we're very hopeful that the money that we were part of helping to advocate for, that will help to bring back those jobs at the municipal level.
Thanks, Fred. Yeah, just to piggyback on what Fred has said, the work that we have been able to do with AMO has really been incredible, and I think it's kind of helped push along some funds that will hopefully trickle down a little more funds will trickle down into the municipalities. The other thing that we've also been working on is it would have been sent to all the presidents was a letter asking the local leaders to work with their city councils to, put together, we had a template letter for you to put your own experience about what's happening in your municipalities and send it off to the premier, and let him know that, not only were, CUPE working with AMO, but now the CUPE locals were also working with their own councillors and mayors to let them know that we really need help. So if you haven't seen that letter, please ask your staff rep about it. It is very important that, you do participate and at least try to get a letter in and let Ford know that we need more money. Thanks.
Thank you, Anne and Fred. There's several questions coming in from people that are saying, many of my members are working from home. How do we engage and participate in these Thursday actions when so many of our members are working from home? Fred, and then Michael, who wants to go ahead? Carrie Lynn? Fred, go ahead.
Sure, absolutely. We want to make sure to share this information with folks, first of all. And so even folks who are working from home, of course, you can share the fact sheet and the take action with them. And you can encourage them. They can take selfies of themselves, like, at home, still wanting their rights restored, right? As Michael's showing now, right? There's ways that we can do this stuff, right? So we want to encourage people to do whatever they can themselves to be participating in ensuring that we can, apply as much pressure as possible. And that includes folks working from home, but it's why our local leaders are so important here. Because you have access to those email lists in a way that we don't centrally. You can be the ones who get this stuff into the inboxes of your members and encourage them to actually take these actions. And folks working from home can participate in rallies in their communities at their local MPP's offices, right? They can still figure those mechanisms out to be able to attend those rallies and to build those numbers as those come to a community near you.
Carrie Lynn, you want to add anything? Michael? Nope. Good. Okay.
Candace, can I just, sorry. It's also, as, local leaders, it's a really great way to, encourage your membership to get included in this, whether they're working from home or not, because that is our reality right now. And that's what people need to see. So, take a picture. I know at my home local, we've been doing that and encouraging people, to participate and, and they send pictures into the local and we post them, we give out prizes, any way to get some kind of engagement going, because we really need to engage our members more than ever right now. And, definitely can be doing it from home and sending it in.
Okay, thank you very much. There is a question about escalating illegal strike activity. So Michael spoke about the hospital sector starting work disruptions. There's a question, given the unprecedented nature of these violation of our rights, are we as an organization considering any escalating illegal strike action beyond a 5, 15, 30-minute disruption in the workplace? Michael, given that OCHU has taken the lead on the work disruptions, did you want to start off here and then we'll go to Fred about the broader CUPE? Go ahead, Michael.
Well, first of all, I want to reassure you that nobody in the leadership, elected leadership, is afraid of the concept of illegal action. But at the same time, we are all very aware that any meaningful activity requires a mobilization of our members. And before we get to discussions about that level of activity, which would be obviously very powerful, we need to see some evidence that we can mobilize people into much less onerous kinds of activities. And so we start with fairly simple ones like holding up posters in workplaces, and we continually have to judge how we're doing. Like on this call tonight, I would have to say that we have some work to do in outreach to leadership, because 220 people sounds like a lot, but actually for our union, that's, we have like over 1,000 or so we should be talking to. We have we need to start using metrics like that to sort of judge our progress. So we need to crank people up. Obviously, we need to do a lot more to convince our local leaders that they should be alarmed by this. We need to draw them in. We need to draw in more and more of our members. And as we do that, the possibility exists that we can look at more serious actions. And I will say, you know, we had a very modest 5-minute work interruption in the hospital sector. And, you know, not everyone wanted to do it for obvious reasons, because it is, it could be seen to be not a political protest, but an illegal strike. OPSU took a different approach and was organizing strike votes in the hospital sector. They were taken to the labor board, and that affected their ability to mobilize. We're trying to ramp things up in a credible, meaningful way. And we're not afraid to lead people, but we need to be leading them. And at the moment, we've got a ways to go, right? So, yeah.
Fred, do you want to add to that?
You bet. I mean, I would just also share, like, remind us all of what Carrie-Lynn and Ann and others have said. Our members have been working really long hours. Many of them are exhausted. And many of them have been working under these emergency orders now for some time. And when, you know, what we've got to do is help them to see that this is not the new normal that people keep talking about, right? This cannot be the new normal. That what we, and encourage them to start to take action in their workplaces and in their communities to build up. We are going to need to apply pressure, and rest assured, you know, we're going to have to think about our next phases. If by October we haven't been effective in getting them to remove emergency orders, then we are going to need to talk about escalating actions. That is absolutely true. But as Michael was just reminding us, the best way for us to be successful in escalating is to begin the mobilization, to share that information. And it's why your role as local leaders is so important, because again, you have access to your members in a way that we don't. You can share that information with them. You can talk to them about why this is a problem. You can talk to them about the potential, or share information that shows them the potential of how their rights could be taken away, even if they aren't today, and encourage them to participate. And then our job is to show that mobilization growing, because as more people begin to participate, more people will join in. It's very exciting that labor councils and the OFL also, you know, contacted us and wanted to join in this work. The more, the merrier, because we're going to need as much pressure as we can apply. And if we can get to a place where we then have that, you know, that ability to actually think about something like a longer illegal action, that's when we can do that. But first, let's mobilize. And if we mobilize and apply pressure in our communities, we might not need to go there. We might actually push the Tories. They're vulnerable to public opinion here because our members are heroes in their communities.
Okay, thank you very much. We have some questions about the concerns around posting pictures online. So if you're participating in these actions, and then, you know, do we have any concerns about the possible use of pictures being taken in the workplace that are being promoted on social media or elsewhere around these actions?
Yeah, I can address that quickly. I mean, what we're encouraging people to do is, like, it's at break or it's at lunch, you go outside, you're kind of in front of your workplace, whatever. You could also do it in front of your union board, whatever. I know that there are places that that say that there are rules. We're not trying to get anyone into trouble here. That's why we're saying to people, do it at a break, do it at a lunch, do it at a shift change. Get, you know, the folks on your shift, 4 or 5 of you together, hold signs, cross your arms, show how upset we are that our rights have been taken away from us, and that we are going to be determined to restore our rights. And we think that in doing it in that way, at a shift change, at lunch, in a way that, you know, perhaps is outside in front of your workplace, etc., that will safeguard folks fully.
There's a question about the times and locations for the rallies. All of that information is available online. I know that while we've been on this Zoom call, the region of York is suggesting that they add to the list and organize an event in their community. We welcome that. If anyone else wants to do that, if your community is not on the list, please let us know and we will help you organize that. So thank you very much for that interest. There was a question about not being able to attend because you're facing possible COVID cases in your workplace. Again, these rallies are spread out until the end of October. So I think people just have to use judgment in terms of what's safe and logical for your participation in a gathering where social distancing is going to be maintained if you've been exposed to COVID cases. So I would just think that folks will have to make that determination for themselves based on the health and safety of themselves and others. You folks know what's best. I think I'll just leave that at that. There's a question about, well, first, before I go to another question, anyone who has questions about pandemic pay or about layoffs or specific situations in your local, we're not really going to get into those tonight, so I apologize in advance for that, but you should contact your local staff rep if you have specific questions about those items, or please feel free to contact CUPE Ontario offline and we can help walk through some of those issues as well, but not on this call this evening. We have a question about what's next. So we do the workplace stuff on Thursdays, and then we organize these rallies. What's the plan going forward? What's next? Fred?
Well, what we're hoping is that these rallies will be large enough and will grow in size as they continue. I mean, we are launching these in August, but as they grow through September and October, we're hoping that they grow in size and in intensity, that we are able to attract local media attention, that there is enough pressure applied particularly to conservative backbenchers, that at these events, there'll be a strategy afterwards in terms of tweeting at and posting on their Facebook pages to apply pressure, that by the time we get to by the time we get into October, we're gonna see more of a willingness to withdraw these emergency orders. But what we must do is also plan for the worst case scenario and think about what is next. Well, how do we escalate action and how do we take that to the next level? And that planning has to happen in a way that makes sense for all of us in our union in terms of folks in healthcare and in social services and in municipalities. And hopefully, as we join, other people will be able to, other unions will also make decisions about what comes next and how we escalate. But I know Carrie Lynn actually wants to speak more about this. So let's hear from Carrie Lynn.
Yeah, I want folks to know that during this pandemic, we certainly feel like a lot of the ways in which we engage with our members, we're not able to follow through on. And that the executive board is speaking very seriously and is trying to come up with a way to not just mobilize our members, but also dig deeper into the rank and file and organize and mobilize our members. Because we could be in this situation for the next 2 years. And there will be more than one Bill 195, and we still have to fight against Bill 124. So we are turning our minds to how do we do things differently? How do we organize and dig deeper into the rank and file? How do we build solidarity cross-sectorally to make sure that it's not just the people who are exhausted on the front lines impacted by this bill, who are standing shoulder to shoulder or 6 feet apart in order to fight back against this government. And these are conversations that we need to have when literally half of our deck of cards has disappeared. And we will be having these conversations and engaging with our members and trying to figure out exactly how we can have the most impact to bring about positive change.
Michael, go ahead.
I think it'd be great if people could focus on the here and now as well, right? If we could book off 5 or 10 people to go to this rally from each local, that's something concrete we can do, and we would surprise ourselves by how many people that would be. And if we can organize these workplace events, I think we have to judge how all of this has gone and adapt our tactics based on that to try to pull in more and more people. There will be a phase 2 though.
Okay, thanks very much. There's been some questions about the social distancing aspect of the rallies and flags. If you have your own flag, you should bring your own flag. We will have some flags at the events. The plan is to collect those flags back and then keep them out of circulation for a few days until we can be sure they've sort of, been in a safe place. They're not going to be reused right after each other. We're also going to be providing masks at all of the rallies, CUPE Ontario branded masks for anybody who doesn't have a mask or who needs or wants a CUPE mask, as well as we have placards that are going to be available at these events as well that say "Restore Our Rights," and those will be yours to keep. We won't be collecting those back. So we have taken some steps to ensure that we're providing swag that's safe for people. And then if you are interested in any swag items that we would be providing at the rally, I would say just contact CUPE Ontario and we can work on how we might be able to get you some of that stuff. I know this was touched on briefly, but does Michael or Fred or anyone else want to talk a little bit again about the possible legal challenge?
Sure. We early on spoke with CUPE, with the director of the legal branch, with the National Union about this possibility. We then went to the Ontario Federation of Labour. I represent our union with Yolanda and Tiffany and others. There are other CUPE members who are part of the board there, but we had they convened a discussion with the heads of unions in Ontario. And there is an agreement that there should be some kind of coordinated joint challenge to this legislation. But there's folks are off to figure that out and to launch a challenge. But I want to share with you what every one of the union leaders and staff who were part of that call also understood. And I really think this is important. Legal challenges take a long time. They take many years. And this legislation allows them to potentially, as Michael was saying to us, and I just want to reiterate this, they can extend these emergency orders for a year, report to the legislature, simply issue a report and get another whole year, and then potentially another whole year. Like, these are elements of our collective agreements, our layoff provisions, our shifts, our hours of work, our leaves. Like, these are important parts of our collective agreements. We can't wait for years of a legal challenge. We've got to try and push them and apply pressure as soon as possible to have them removed. But the precedent of this legislation has to be challenged, and it will be.
Okay, thank you very much. For those of you who are now reaching out about masks, please feel free to contact the CUPE Ontario office and we can talk to you about the purchasing of masks. And for the suggestion about branding the masks specific with messaging, we think that's a great idea. We did have the order in before we knew about sort of the Bill 195 challenges. And so for our next order of masks, I think that's absolutely something that we can look at. There's a question about how can we get retirees more active and involved in these organizing? Fred, do you want to take that?
Sure, we have a retirees network, and so we will be sending this information through all of our retirees, encouraging them to be active and engaged, to RSVP, to come to the rallies, to also, take photos, etc. But I really want to encourage folks who are part of retirees networks inside our local unions, or who are part of retirees networks in some of our CUPE councils, to also, be involved in those networks beyond the one that we've established. We really want everyone in our union to be as engaged here, and that includes the huge pool of folks who are retirees who would be active and engaged here.
There's a question about other unions. Are other unions going to be participating with us in these rallies, and how are we organizing with other unions? Michael, do you want to start? I know Fred can talk about the OFL, but we're already teamed up with some Unifor folks. Michael, do you want to take that?
Yeah, I think for sure we're going to see the healthcare unions, OPSU, SEIU, Unifor. Unifor is going to co-sponsor rallies in Thunder Bay and the Sioux. Fred, you've been to the OFL, and that was a really good response there.
Yes, in fact, the OFL wants to ask if they could use our slogan, "Restore Our Rights," if they could brand it with our logos, but also their logo, and that they could share it through their labor councils. They've committed to sharing it with all of their labor councils, to directly contacting labor council presidents, to ask them to get people to participate from other unions at these rallies and to join the campaign. And they've also convened a meeting of the Political Action Committee that includes representatives from all the unions to talk about what other actions the OFL will help to coordinate with other unions alongside these rallies to apply pressure to have these emergency orders revoked.
Okay, there's questions about how can we get more media attention and more media presence on these issues, and how are we going to get the general public on side to support us?
It's part of the strategy that we have about having these local and a large number, frankly, of local rallies, because local media will attend, local media will cover these issues. And it has been a real challenge through this entire time. I want to say thank you to folks like Carrie Lynn has issued a number of statements and has been able to break through and get some media. Candace has done an excellent job talking about long-term care issues. Michael's been able to get some media attention to a variety of issues in healthcare, particularly around PPE. And Anne's been working really hard to get attention to municipal funding issues. But it's been a challenge for all of us to get attention. And it's why part of this strategy is to use this organizing on the ground to bring a groundswell of support and to try to get as many sort of local folks actively engaged and local media actively engaged. We're also going to talk more about a public campaign and what else we can do to get this word out, to bring people on side, because we know that our members have, their family members, their neighbors, they know how important the jobs that they've been doing and have done through this pandemic are to their communities. And I think most people don't even know that our members' rights have been suspended in this way. When they find out about it, they're going to be, we believe, inspired to support us through our e-actions and in other ways.
Okay, and a last comment, and maybe I'll give this to Carrie Lynn. What about Communities Not Cuts, and will Communities Not Cuts be linked to these efforts? Carrie Lynn, you want to take that one?
Thanks so much for that, Candace. So the Community Not Cuts campaign, the next phase of it is that we've actually joined forces with the Ontario Federation of Labor, and we are currently conducting a survey to get a snapshot of what is the priority issue when it comes to different communities. And we're working with connecting CUPE councils with labor councils in those communities to mobilize around those issues. So there is going to be a webinar coming up. If you check out the CUPE Ontario Facebook page or the CUPE Ontario website, I believe we are promoting that webinar broadly. It is next week on the 19th, and you can engage that way. And there's activist training. You can sign up for that. And the phase of this is actually called Building Power in Our Communities. So it's a hybrid of Power of Many as well as Communities Not Cut. And I think in our next phase of planning of how we mobilize and move forward with the Restore Our Rights campaign, we can certainly turn our minds to how do we use the Communities Not Cuts campaign platform as well to build some momentum and to fight back, especially when the legislature comes back and we have greater opportunity to get some media coverage.
Right. Okay, thank you so much. I think I'm gonna stop it there because we have reached the hour. I know Fred just wants to wrap up and say a few closing words. There's just a couple last comments. One about wanting to hear more from the NDP about this, and I know that Fred and others from our office are in regular contact with the NDP, and so we're gonna be making sure that they are actively continuing to be a strong voice on this question. And for the suggestion that we use local members as spokespeople in the media releases when we go into the communities, that's a really great idea. We have our communications folks on the lines tonight who will be working on those, and we will absolutely be looking to do that. If you haven't had a chance to ask a question or your question hasn't been answered tonight, please feel free to message us at info cupid.on.ca, and those messages will be responded to. So I just want to thank everybody for the opportunity to participate tonight. Really, thank you for being here. It's been fun, and we look forward to growing these as we move forward. So Fred, turn it over to you for a few closing remarks. And you're on mute.
Just when I thought I had the technology down, eh? All righty. Look, I want to say thank you to all of you for participating in tonight's call. I want to remind you that all of this information is on our website at cupid.on.ca. There is a banner, Restore Our Rights. When you click on it, you can get access to all of this information. I really want to encourage you to participate in this campaign, to share this information with your members, and to get them to participate in social media by sharing a story. I think the idea of having local spokespeople tell their stories about what's happening on the ground is our dream. So if there are folks in communities around the province where these rallies are happening who want to do that, please be in touch with us so that we can help to connect local media with you. Look, I know that these are trying times for all of us. CUPE members are doing work that has made sure that our communities have got through this crisis. They're taking care of so many people across Ontario. And I really want to say thank you to you all personally for the work that you've been doing in your community, that you continue to do in your community, that you're doing with your local and with your members. And I know that as we engage in this campaign and we build momentum, we will be able to push them back on these emergency orders. We will restore our rights. I want to thank you all again for tonight and just say, stay safe, everyone.